Hello, good morning to one and all present over here. This is Dr. Shankar presenting you the topic for today. Has COVID eclipsed all other medical sciences? Yes, this is a huge topic, and we have a lot of things to be discussed. And really, this COVID, ever since its inception, it is being eclipsing every other diseases, right from small diseases, maybe the common flu that we are encountering right now in this season, and even the big diseases like diabetes, hypertension, strokes, heart attacks. Yes, it is eclipsing every other disease. A scene has come as if there is no other diseases being available on this earth, and everybody here right around our nose are focusing towards diseases that are correlated with COVID and Corona. Yes, I'm going to present you some 5 important topics on COVID and its COVID management right now being present here, and the recent ICMR guidelines, the recent studies that has been out from the Scotland regarding the vaccination status, and the final take-home message we will be discussing on this video. And regarding as far as the participants who are attending this YouTube video, you are open for your questions, and if your questions are being on the board, I'll be answering all your questions as far as with COVID and other medical diseases are concerned. So let me take the first point of discussion today, brief outline of COVID. Like, let us go for a flashback how it has happened all throughout this 1 3/4 year ever since COVID was born. As per records, the date of birth of COVID is 31st December 2019 in the Wuhan city of China, and it has been spread like fire, like a forest fire all over the globe. Yes. Please hold on for a minute. I have a couple of guests being joined along with me, and ever since its inception of COVID, you can sit here. No, you can sit here. So ever since the inception of COVID, so let me tell you a flashback of how COVID has started and its inception since December 2019. So when we all got a first video seeing all the raw flesh being sold in the markets of China, we were all wondering, this will not be coming to our country. Whoever be in the world, be it in the China, be it in India, be it in Italy, be it in the US, all those who saw this videos saw that this is something happening, not for us, and it is something a regular WhatsApp video that we used to be enthusiastic on seeing, and we were all amazed by seeing the video, and we just saw how the food culture in China was. But ever since the first cases of COVID are being reported in every country, and then the pandemic and the panic started. And from March to, as far as now, my discussions will be pertaining to India, and ever since from March 24, 2020, we had several guidelines being quoted upon, be it the metallic sheets that were kept to close the streets, to close the apartments, to close the roads, and then we had sanitizers. We had sanitizers all around, everybody, everywhere, in the house, in the police stations, in the railway stations, in the booths. We had masks. I usually used to wonder, usually the surgeons and the anesthetists used to wear masks, and everybody seemed to be looking like surgeons and anesthetists walking on the globe. It was really wondering, and it was really amazing to see such. And then we had several lockdowns, be it from intensified like 144, that the entire roads were like a tsunami. It was completely empty, and all were within our campuses. Then we had social distancings, then we had vaccines, and this is how it was slowly evolving. And as of now, certain measures are being left up, like the metal sheets that were used to close the roads, to close the apartments, are now being left back. The streets being closed, the concept of closing the streets is left back. The sanitizers using concept is slowly fading away. The lockdown as of now is now in namesake manner, and social distancing is hardly followed. But vaccination, yes, the topic of today, the vaccination is being mass vaccinated, and we are going to discuss about those things in the forthcoming video sessions. And the next point of interest is how other specialties of medicine has been eclipsed by the word COVID and corona. Now let me take one specialty of obstetrics and gynecology whom I ever pitied upon. Yes, suppose obstetrics and gynecology means, as you all know, pregnancy is a natural process. Everybody, every organism in this world is perpetuating. Perpetuation is the rule of thumb. Perpetuation happens on the globe everywhere. Take it to the mosquitoes, rats, giraffes, elephants. Anybody on this world perpetuates, and that's the Charles Darwin's theory says perpetuation of life is the very ultimate element. Now, many of you and many of your family friends would have encountered this kind of scenario. Somebody is admitted for safe confinement, be it a normal delivery or LSCS, that is a C-section. They are being routinely screened for RT-PCR for COVID. ICMR guidelines clearly says that asymptomatic people need not be screened for RT-PCR for COVID. This is one thing which is eclipsing our obstetrics and gynecology practice. Imagine otherwise a healthy 25-year-old primate who comes for safe confinement. Her chest is clear, her hemoglobin is good, her random blood sugar is good, her weight gain is good, the fetal movements are good. If she is going on for a normal delivery process and accidentally, by the routine standard protocol of checking RT-PCR for COVID for every antenatal mother, makes you panic. As a physician, it makes you panic that we are going to encounter antenatal mother who is COVID positive. She might be an asymptomatic carrier. She might be a routine normal RT-PCR positive just by herd immunity, and anything she can be, but the fate of the antenatal mother differs. The place where the antenatal mother was taking antenatal treatment, be her hemoglobin checks, her weight checks, her BP checks, is now going to slowly fade away. She is going to be referred to a hospital which takes care of antenatal mothers, panicking every mode, and this panic will spread to the antenatal mother too. The stress can cause maternal tachycardia, the stress can cause fetal tachycardia, this can go in for fetal stress, and it can go in for a tough labor, and it can get converted into a emergency LSCS. Now let us go to orthopedics. I like to focus on elderly, the specialty which I'm daily, day in and day out being taken care of. Elderly who fall at home, whose hips are broken, and they're being posted for a open reduction and internal fixation, be it hemiarthroplasty, partial hip replacement or total hip replacement. If as a routine protocol, an asymptomatic elderly, if we are going to check his RT-PCR status, again, if he is going to be a herd immunity positive, then the attitude towards how we are going to attend the fractured neck of femur patient is going to vary. I'll tell you a small case history. A 72-year-old male had a fall on 31st night, December, 7:30 p.m. He was rushed into the nearby hospital, whereas a routine protocol, his RT-PCR COVID status was taken, which was turned out to be positive, and meanwhile that test took at least 24 hours for the results to come, and meanwhile the patient was evaluated for surgery like ECG, echo, chest x-ray, everything was done, and once he was prepared for surgery, his RT-PCR report came as positive. Then he was referred to the nearest COVID care center, probably in Chennai. He was referred to a government hospital where he was admitted, and the patient's attenders were panicked. The patient was panicked. The patient was in a COVID block, not in an orthopedic situation, and the patient is now still awaiting for surgery, and in the due course of time, he has developed the consequences of bedriddenness, urinary tract infections, he has developed aspiration pneumonia, he has developed bed sores. A right royal candidate for surgery, a right royal candidate for hip replacement, a right royal candidate for open reduction internal fixation, his fate has changed because of COVID. That is why I have kept the title Has COVID Eclipsed All Other Medical Sciences? And I have somebody saying about the various data from CDC included that 965, 843 reports of adverse events following COVID vaccines including, and he has a lot of data. So for those who are interested, please get along with the YouTube chat. And the serious injuries between 14 December 2020 and 10 December 2021, Megan Redshaw. And the fate of this orthopedic patient who required a surgery has just been like a dream. Now he is bedridden and now he is marching his way to death. Yes, really the COVID has eclipsed regarding how the COVID is, we'll discuss at the conclusion, but COVID has eclipsed every other specialty. Now let me take general medicine. This is my first experience that I experienced on April 2020. The first 2 COVID patients that I saw in my career was admitted for stroke. And as a routine protocol, as per guidelines, we took an RT-PCR positive. And you please imagine and believe me, this was the first COVID patient that I encountered in my practice. As soon as I got the report of COVID positive, all my staff in our center really panicked. They failed to touch the patient. They failed to go to see the patient. They failed to give bed care. They failed to give nutrition. The patient was simply abandoned for being COVID positive. Yes, it was everybody's fear and it was fear of mine too. And we immediately reported to the nearby COVID care center and the patient was referred to a government hospital. And you also have to believe that the same fear, the same panic was there in private hospitals as well as in government hospitals, and slowly the patient passed away. If at all her stroke was managed, she was in the golden hours. She could have been heparinized, she could have been anticoagulized, and she could have been saved. And a patient from general medicine, just because of being RT-PCR positive, she didn't have any other symptoms of breathlessness, desaturation, but her simple single line of RT-PCR positive has eclipsed her medical outcome. Now let me come to ophthalmology. Several patients since March 2020 have been awaiting their cataract surgeries, their intravitreal injections, their other ophthalmic procedures. Take it for cataract surgery, low vision. Just because of the pandemic and panic of COVID, the patient is not coming out for getting for ophthalmic evaluation. And even after ophthalmic evaluation, they all say, let COVID konja koraitum, let the COVID come down a little bit, then we shall get operated. And the elderly is still continuing. Several elderly are continuing in low vision. As you all know, low vision can cause depression. Low vision can cause falls. Fall can be fatal. And just by the word RT-PCR positive, patients are being seen as HIV positive. Isolation. Let me come to the last but not the least, the big problem of isolation. Let me tell you some stories about imprisonment. The word imprisonment means confinement. The person who is given imprisonment, the punishment is not always hanging. The punishment is not always a judicial hanging. He is being cut from the society. He is not being allowed to participate with his friends and relatives and society. So the patient is being confined. And this is the concept of imprisonment. Ditto, dot to dot, similar problem we are facing with confinement and isolation. As you all imagine and all you know the story of four cows and lion. As long as the four cows were united, the lion couldn't do any activity, could not kill those four cows. And we people are now like those four cows, and we are being attacked by the lion called COVID. Our unity is lost. Even if our relative asks, can I come to your home? Can I come to visit? No, 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 no. Let this COVID settle down. Then we will visit. We are afraid to call our own relatives. We are afraid to go to their homes. We are afraid to attend their funerals. We are afraid to attend their family functions. And this is all putting us into confinement, and this is going to increase our stress and depression, which can lose our immunity, and this can amplify COVID. So let me come to the fourth important point: children. Yes, why? Because I didn't touch pediatrics, because children are having so much good immunity towards any infection. Park textbook of community medicine says that a child needs to get at least 4 episodes or 5 episodes of upper respiratory tract infection, 5 episodes of acute gastroenteritis every year to build immunity. A child that doesn't play on mud, a child that doesn't play on sand, a child that doesn't play on ground doesn't come up in life in a big way. The children are being put back in homes. The children are becoming obese. They're getting tuned to snacks. They're getting tuned to some junk foods. They're becoming obese. They are being seedlings. I see these children as seedlings of non-communicable disease, as seedlings of diabetes, as seedlings of hypertension, as seedlings of dyslipidemia, as seedlings of hypothyroidism. What a non-healthy environment, what a non-healthy future that we will be building upon in the days to come. Yes, the children, once we were saying and we were asking them not to use cell phones, are being forced to use cell phones. Do you feel it is going to be an easy task to get back the cell phones from them? And do you know how much will be the quality of education through online education? I just inquired few teachers. I asked them, how is the students' feedback? How are the students behaving after coming from the routine big lockdown? They're not able to read. They're not able to concentrate. It took some 15 days to 1 month to get them concentrated on books. And I'd like not to add much on porn videos that children are getting addicted to. That leads to a lot of psychological stress and mental trauma, which can again lose our immunity, and this can amplify COVID. So coming to the nutshell, what is my discussion and outcome? What I'd like to put it in the conclusion of: has COVID eclipsed all other medical sciences? Yes, it is a big yes, as I already got few replies through WhatsApp, through Facebook, through the social media, the doctors, my colleagues. And this request is both to my doctor colleagues and to my non-medical friends. Let us treat this COVID like any other diseases. Before coming to the conclusion, I like to tell a small example of how our center works with COVID. We understand and we treat COVID like any other diseases. We have neither been infected or we have not amplified any diseases of COVID amongst our patients. Our fear has come down, our confidence level is better, so that our immunity is improved. Every textbook of immunity, every textbook of infectious diseases says that stress, I'm stressing upon, stress plays a vital role in deploying your immunity, in breaking your immunity, in shattering your immunity. So let us treat COVID like any other illnesses. Let us vaccinate only the vulnerable. Mass vaccination will never be a key for a highly mutating RNA viruses. The story goes like this: as you are inventing a vaccine, the virus turns its face. It's like you invented key, But the law changes. It is highly unscientific to vaccinate in a mass, especially the children who have a very good immunity. See, the thought of desire is like, if you vaccinate the children, they might not be they might not be getting infected with COVID in the future. Now, let me tell you one example. Can we give anti-diabetic medications for non-diabetic, அதாவது சுகர் இல்லாதவங்களுக்கு சுகர் மாத்திரைகளை கொடுத்தால் பிற்காலத்துல சுகர் வராமல் இருக்குமா? My question is, if a person has no hypertension, if he is given antihypertensives, will he not develop antihypertension? Will he not develop hypertension later? The concept goes like this. So, mass vaccination will not help in preventing disease in a virus which is highly mutating, and whichever it is a RNA virus. And that's how the story ends with me, and I'm open for discussions for a couple of minutes. Any questions you have, you can post it on the chat group. Now the time is exactly 21 minutes past the session. I thank everyone who has listened patiently for the noble cause of let us not make COVID eclipse all other medical sciences. Let us stand against mass vaccination, which will not be scientific, which will not help in a highly mutating RNA virus. Let us not change the fate of any other medical illnesses just because of COVID and Corona. And I'll be open for the next 10 minutes for any discussions in the chat box. If there are no questions, and if the questions are coming in the future, we will be answering it in the comment box. And thank you for your patient listening, and I hope it's a Sunday morning. Thanks for your time, and my sincere thanks to my teachers, my seniors, my colleagues, my juniors, my schoolmates, my college mates, my patients' relatives, the entire society for understanding us, for getting way. And if you are like to add any comment, you can mention in the comment box. Thanks for listening patiently. So please take this carry home message. Let COVID not eclipse our other medical specialties. Let us stand against mass vaccination. Let us not vaccinate our children, which will spoil the immunity, which is unscientific, and in especially highly mutating RNA viruses. And let us not spoil the future of children by keeping them back at homes. They're becoming addict for phones, they're becoming obese, they're becoming seedlings of non-communicable diseases. And my job is done. And thanks for your patient listening, and thank you. Have a nice day. Thank you.